places. Let's talk to one of those experts right now. Joining us, director of the Harvard Global Health Institute, Dr. Ashish Jha. He's a practicing physician, also professor of medicine at Harvard Medical School. Dr. Jha, great to have you with us again. I just get you to react to the president's characterization of testing as something that would be nice to have, but it's not necessary.
Yeah, so Willie, thanks, and all of you guys for having me back on. So everybody else has led with this, and I'm going to lead with this. We cannot open up our economy without adequate testing. So let's just think about what would happen if we did. Let's say May 1st, we open the doors, everybody's back to work. It'd be great for a few weeks. For a few weeks, we wouldn't notice it at all. And then you would see massive flare-ups of cases across the country. All the hard work that Americans are doing will have been wasted. And we will have to shut down again, and we will shut down for much longer. So if that's what we want to do, then yeah, sure, let's open up May 1st without adequate testing. But the right answer is, and again, to quote Dr. Fauci, we don't make the timeline, the virus makes the timeline. So let's wait until the viral levels are really low in our country. Let's have a very robust testing system. Then let's open up slowly. And I actually think we can stay open, which is what Americans want. We do not want to have to shut down again.
So, Dr. Jha, we've talked about all these issues, the personal protective equipment, but testing really is the first thing that we hear from doctors like you who are experts in this area. What does a national testing system look like? Obviously, that's a long road to get everyone in this country tested. We know that because right now it's a patchwork of private laboratories and companies coming up with a concept. Some of them are quick, some of them are still in development. How do we get everyone tested much more quickly than we are right now?
Yeah, so what we do need is national coordination, right? So every state has different barriers. I mean, there are states that can't test because they don't have enough swabs. And I sort of, I shake my head thinking, we've shut our economy down because we don't have enough swabs? But yep, that's the problem in some states. Other states don't have reagents. Some states don't have infrastructure. And the point of a national strategy is that we need a federal government that coordinates, that makes sure that all these barriers are going away. The tests are going to be local, but the bottom line is we're not going to get the kinds of tests we need. And I say not every American needs a test, but everybody who needs a test needs to be able to get that test. And we are far away from that. And we're not going to get there through 50 different state strategies. We need a national strategy.
Dr. Jha, let me ask you about the flattening of the curve that we seem to have witnessed as Governor Cuomo holds these news conferences in hospitalizations. Obviously, the deaths are spiking. The governor has talked about that as a lagging indicator of how to read where this is headed. What do you see in some of the numbers coming out of New York City where hospitalizations, at least, are way down? What does that tell you?
Yeah, so I think Dr. Fauci said this earlier, and let me amplify. The incredible hard work that Americans are doing staying home. I know staying home, having the economy shut is very painful, but it is working, and it's working in New York. It's working in California. It's working in Washington State. It's working in Ohio. It's working wherever we're doing it right. It is painful. And by the way, the number of 60,000 deaths, and it's great. Fewer Americans dying is always better. It's more people than died in Vietnam. This is still a tragedy. And we've got to stay home and try to get those numbers even lower if we can.
All right, Dr. Ashish Jha, thank you as always for your insights. Good to see you this morning. Joe?
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.